Before we get to treatments, let's talk about the stages of ACM. Like most diseases, doctors will try to decide which stage of the disease you're in before you decide on a treatment plan. ACM staging is a little different from the staging for other diseases. There are three main stages of the disease. Stage 1 of arrhythmogenic cardiomyopathy happens before you start showing obvious symptoms. If you're in this initial stage, you may or may not have any structural damage to your heart yet. It's rare that someone is diagnosed at this level of the disease, unless they have a family member with ACM who is showing symptoms and happen to get tested themselves. Stage 2 is where most of us were diagnosed with ACM for the first time because we started to show symptoms of electrical problems and structural changes in our hearts. Maybe your case started with just fatigue or palpitations, or maybe your story mirrors mine. Most of the people diagnosed with Stage 2 ACM are treated first with a combination of different medications, but there are also more options beyond medications we'll talk about in the next video. ACM is a progressive disease, so your healthcare team will keep a close watch on your heart and your symptoms over time. Stage 3 often begins with more severe structural changes in your heart, like heart wall thinning, or at least one chamber of your heart stretching and weakening. This can eventually cause heart failure, especially if there's damage that affects more than one chamber of your heart. You might notice swelling in your limbs and your abdomen, problems with your systolic blood pressure, more frequent irregular heartbeats, chest pain, shortness of breath, or other symptoms that may indicate you need more than just medications to help manage your condition. In some of the other videos in this section, we'll talk about those more advanced treatments that your healthcare team may recommend in Stage 3. When you're living with arrhythmogenic cardiomyopathy, the first line of defense is usually medication. For me, the doctors decided to start with two main kinds of medicine: blood thinners and antiarrhythmic drugs. The first type of medicine my healthcare team recommended was a blood thinner. Having an irregular heartbeat puts me at much higher risk of stroke, heart attack, or a blood clot in my lungs. Blood thinners, or anticoagulant medicines, don't actually thin your blood. They just help the blood flow more smoothly through your blood vessels. Most blood thinners work by chemically limiting the ability of your platelets and red blood cells to stick together to form clots. It's important to watch for any signs of bleeding or bruising that are unusual for you if you're on a blood thinner. Your healthcare team can guide you through selecting a treatment plan that works for your needs. Being on an antiarrhythmic medication helps keep my heartbeat more regular. They can help prevent or reduce that fluttering or pounding in my heart that sometimes makes me feel sick or lightheaded. This kind of medicine slows down the electrical signals in my heart so that it's easier for it to beat regularly again. There are different classes or groups of antiarrhythmic medications that are more commonly used with ACM. Two of the most common kinds are potassium channel blockers and beta blockers. Potassium is something you probably eat all the time. It's usually found in foods like bananas, spinach, avocados, and some dried fruits. When you have ACM, sometimes the best way to prevent irregular heartbeats is to slow down the electrical impulses in all the heart cells. Potassium channel blockers prevent potassium from crossing cell walls to do just that. They close some of the little canals that would normally let just the right amount of potassium through. If there's less potassium getting in, the whole process slows down enough so that your heart doesn't have to work as hard to beat regularly. Beta blockers can also make your heart's contractions less forceful and slow your heart rate. They help block hormones like adrenaline. Remember how the SA node and the AV node work together to trigger every heartbeat? Beta blockers primarily target the SA node and the AV node to regulate the heart's electrical signals from the source. Some beta blockers can also lower your blood pressure and widen your blood vessels to ease the burden on your heart. Your healthcare team may decide to use a single drug or a combination of medicines. Besides the antiarrhythmic drugs, there are many other medications that can help reduce the workload of the heart. Using either ACE inhibitors or angiotensin II receptor blockers, also known as ARBs, can be useful in ACM treatment. These drugs can block production or use in the body of a hormone called angiotensin II. Without so much of that hormone, blood vessels widen so blood can flow more freely, blood pressure is reduced, and the heart doesn't have to work as hard to pump. ACE and ARB drugs can also produce inflammation in your body. Diuretics, sometimes called water pills, help your kidneys release more sodium into your blood. That process makes it easier for your body to get rid of extra fluid by making you pee more. As your body gets rid of the excess fluid, your blood pressure actually goes down. If you have swelling in your limbs or other areas of the body, diuretics can help bring that swelling under control. There are many medication options for treating ACM: antiarrhythmics, blood thinners, ACE inhibitors, ARBs, diuretics, and more. Whether you're in early stages or a more advanced stage of ACM, there are lots of combinations of drugs that can be customized to meet your needs and slow the progression of the disease. Please check out some of the other resources in this section to find out more, but we've only scratched the surface here. Your healthcare team's expertise is your best guide to the treatments that are right for you. Thanks for watching.